Welcome, everyone. We will be joined today by Dr. Laura Jana, who starred in our film, Starting at Zero, Reimagining Education in America. What initially attracted us to Dr. Jana is that she works across disciplines and wears many hats. As a pediatrician, educator, health communicator, and award-winning author of The Toddler Brain and other notable books in the early childhood space. She finds connections across disciplines and crystallizes big ideas into far-reaching real-world applications with a focus on social impact, which so perfectly aligns with the ethos and goals of our film. Dr. Jana is currently an associate research professor at Penn State's Edna Bennett Pierce Prevention Research Center and was most recently Director of Innovation in Public Health at the University of Nebraska Medical Center. We're so thrilled to welcome Dr. Jana to join this conversation today. But first, here's a snapshot of her role in Starting at Zero.
The job in early childhood is to instill skills, and if you don't have that in the adult, you don't get it in the child. It's almost like a light switch turns on through social interaction that then makes babies learn new information and act like sponges. We are social beings, and the connecting of neurons in the developing brain is inherently dependent on social interaction. Caring, responsive adults, and it's setting kids up with the skills they need to succeed in life.
Welcome, Laura. So glad to have you here.
Oh, it's great to see you again. Glad I could join in.
Thank you, thank you. So, Dr. Jana, the world has changed since we first interviewed you for our film about 2 years ago. Can you talk about the ways that the pandemic has magnified the urgency of early childhood education issues in our country and the need to get it right?
Absolutely. And what's interesting is, in some ways, the world has changed a huge amount because of the pandemic and all that's associated with it. At the same time, what hasn't changed is what we know and already knew about early childhood. I think what's really changed is people's awareness. Those people who didn't quite understand how critically important early childhood, early education and childcare, those issues are parenting, now have a really good sense. And I think there's uniting around the sense of both its importance and its urgency. The two areas that I see really kind of coming to the forefront in everyone's minds, one certainly is the challenge for parents faced with having children at home, trying to juggle daily responsibilities of work and home life with the not just caring for, but education of their children. And that's a big challenge. The other piece of that, though, is this isn't just about parents' ability or inability to work, depending on whether their kids are in school or in quality childcare settings during the pandemic. It also relates to what we know those children need. It can be very difficult to focus on sort of longer term outcomes when faced with a threat. And if we've ever seen a threat, the pandemic counts as a threat. But I think now we've reached a point where we can say we know about the hand washing and the mask wearing and the social distancing things, but we also know that if we don't pay attention to what happens in early childhood, there will be long-term consequences, and it's now more clear than ever.
Absolutely. Thanks so much for sharing that. So I know we have a lot of parents tuning in, which you were just speaking about. As a pediatrician and educator yourself, can you share some advice on things parents can do to help kids adjust to the current circumstances and not lose momentum with their learning?
Absolutely. And it's such a great question because it really gets to the heart about what we know all children need. And quite honestly, before we can even talk about education in its sort of traditional or sort of broader sense, children need to feel safe, they need food, they need to be secure, and a caring, responsive adult is critically important. That's what parents can focus on first, because even when we as parents don't feel particularly safe or secure or like we know what's coming next, we have the ability to provide that sense. Again, it's a caring, responsive adult providing a sense of security and stability for children. The other thing that parents can do is, in some ways, it's take pressure off of themselves, but also commit to realizing just how important those kind of caring, responsive interactions are with children, not just for their sense of security and well-being, but from an education standpoint. I hear a lot of discussion in the education realm and in the early education realm around what I kind of consider to be more the flashcard academy kind of aspect of education. And I don't even have anything fundamentally against flashcards. But the amount of education that's done on the sorts of skills beyond just reading, writing, and arithmetic, or pre-literacy skills and those sorts of things, curiosity and questioning and trying taking testing things out, trying things, interacting with the world around you, are critically important educational foundational skills that parents can foster at home. And it doesn't have to be in front of a textbook, it doesn't have to be in front of the school's computer screen. That takes some of the pressure off of a parent who thinks they need to start creating their own worksheets, which they don't need to do.
Absolutely. So just tuning into what, children need right now in the moment and using the environment around them, as their classroom, which is, how children learn best. So
Yeah,
thank you.
and the other element there, Willa, which I want to mention, is we know that children, but people in general, function best through relationships, right? Engagement, relationships. And it's a very unfortunate choice of words to have us all talking about social distancing, because the point is not social distancing. It's physical distancing, right? In one of my hats, I do infectious disease and vaccine information and things like that. We want to physically distance ourselves to prevent the spread of a virus, but we don't want to socially distance ourselves. And that's where, whether it's how we interact with our children, how our children can interact with peers, how they can connect with their teachers, even in a virtual space if need be, is really important for the well-being, not only of our children, but for ourselves as well.
Definitely, like how to maintain this social fabric even when we can't physically be in the same space. So, which is part
Exactly.
of why we're doing this virtually. So we appreciate your being here. So, a vaccine has just been approved for use in the US, and there's another one potentially on the way. When distribution of the vaccine becomes more widespread, will things go back to the normal, or will the pandemic and home learning have fundamentally changed the conversation and structure for early learning in this country?
I think that I mean, people can kind of, take hope from the fact that there's a vaccine. That's absolutely true. But what we know, and again, through my work in infectious disease and as a spokesperson for the American Academy of Pediatrics and all, it's not going to be instant, and it's not going to have everything just go back to normal. And in some ways, that's actually good, because what we've seen is what's possible as we all struggle to maintain our sense of connectedness. How do we make sure everyone has access, not to just education, but early education? And there are things popping up all over the place in the early childhood realm that make it possible to do that in ways that I think we were a little bit, not you and I, because we were looking at sort of this sort of innovation in the space, but as a whole, as a country, we were a little bit timid to get there. We were doing incremental steps towards how do we give better access to everyone and what can we do with virtual and things. And the pandemic forced our hand to get there faster. Some of that's for the better. I do want to point out also that one of the things that you and I know we both care deeply about, and it certainly came across in Starting at Zero, is, and how do we make this possible for everyone? What motivated me to write the Toddler Brain, what motivated you with Starting at Zero, is saying, if we know that what young children need, they've got this core set of needs in early childhood. We know that a caring, responsive adult is absolutely critical for improving children's life outcomes, letting them live up to their potential. What does it mean for the children who don't have it? And how do we inform everyone, from parents to educators to policymakers and funders, to all come together and invest? And I think the pandemic has pushed us in a really good direction, where there are a whole lot of people joining our team who see the value of those prospects. And what's good for everyone is good for our own children, right? We do it for our kids, but we also do it as a country to support all children and early childhood.
Absolutely. The pandemic has really brought to light inequities, whether it's broadband access, so, kids can access remote learning and, just so many access to, testing and healthcare when needed. So, I hope in some ways that it's a reckoning so that we can, build better systems of support, and definitely
You know,
starts with early childhood.
that's another really good point, and one that I, as a pediatrician by training, who've also taken this big dive into early education and childcare, want to point out, because there is this really important intersect between health and education. And in fact, I make the case that you can't really separate the two. Like, you can't have a child who's healthy, who's not educated, and having a child who's educated but not healthy. They're really tough to do separate from each other because they're all intertwined. In the film, you spotlighted what the state of Alabama is doing. And a lot of people, again, divide this into education, like reimagining education in America. But what you find in programs that are really well done is this sense of it's the whole child. It's the academics, the reading, writing, arithmetic sorts of things. It's the social emotional skills and well-being. It's the safety, it's the nutrition, it's the access to health and healthcare. And that really is becoming all the more clear with the pandemic, so that you see those entities responsible for trying to provide children and families and communities that support, realizing we have to come together to make that happen.
Absolutely. And in some ways, there are a lot of resources out there, but it's just connecting the dots and getting the systems to work together. So that's the challenge
Which
and
is
it's the opportunity.
which is actually, the other thing the pandemic has done is people in general don't like change. And we start to look at things in a set way based on what we know and what we've experienced. And then all of a sudden something comes along and it turns the world upside down. Being able to take that and now do something new and test things out is one of those core skills that actually develops most rapidly in the first 5 years of life, if we cultivate it. So it's a really important skill to have, but it means that we now have this opportunity to say, let's not just get stuck in the way we are doing things. Let's start to look around and see who else has those same interests. It requires hopping around different sectors and professions. And I got a little challenged at explaining what it is I do. I mean, the easy answer is I'm a pediatrician, but then explaining how I'm involved in all these other things. I have on my business card connector of dots. I'm trying to pull those different things because I realize at our core, we all have the same vested interest, and that it's in everyone's best interest, whether you're a business person, a parent, a teacher, a physician, whoever you might be, to invest in early childhood, right? For the sake of our children, for our families, for our workforce, for our country, for national defense. I mean, you can take your pick of which outcome you want to look at, the health and well-being. It all points in the same direction for investments in early childhood.
Definitely. Well, that's why we like talking to you, because you help us connect those. So, we all want high quality systems and positive outcomes for our young children and families, but it can be really hard to know where to start. Do you have any suggestions for how our viewers can help make quality early childhood education a reality in their cities and states?
Making early childhood a reality can happen at several levels. For a parent, it can be as simple as, first of all, realizing how valuable some of those things that you do in early childhood that you might see a childcare provider doing in early childhood, the talking, the cooing, the playing, the singing, the reading. They're very cute, they're warm and fuzzy, but they're way more than that. And realizing that it's not just the age, the value of what you do, whether you're an early educator, for example, the value shouldn't be determined by the age of your student, right? So that college professors are at this level and early educators are seen at this level. So part of it's just valuing what's being done in early childhood, valuing what parents are doing, valuing. You'll notice I tend to say early educators a lot as opposed to just childcare or daycare providers, because unfortunately, historically, we've treated that like babysitting. The next level up is, and you get what you pay for, not in a sense that the early educators aren't providing what they want to be providing, but we as a society need to value it, not just like the thank you for doing what you're doing, but actually having pay commensurate, which is where the Alabama model that you featured at Starting at Zero, what was stunning for people, and some people may not realize how stunning this was, is that Gina Ross and her group in Alabama managed to get pay parity, the same pay for early educators as those in their K-12 system. That's huge because where I'm at, I'm here in Omaha, Nebraska, and I owned a childcare center for 10 years. And I was looking at it, how do you actually make this happen? It's one thing to talk about it, but making it happen is challenging. And I had to think about the fact that all of the childcare in the area where I opened my school, you could get a higher starting salary at Target, walk in the door and get hired, than you would as a teacher in most of the childcare in the area. So that's where it's seeing the value and then advocate for it. If you're a business leader, you carry a lot of sway when it comes to policies, to funding, to prioritizing what's done. And as we've all seen, this can be state by state, it can be city councils, it can be with your school boards, but supporting efforts that support not just children during the early years, but their caring responsive adults, whoever they may be, the parents, the early educators, the foster care system, all, home visitation, all of these things. We all need to come together and make clear to everyone that in our communities and in our country, we actually value that, and we're going to put money where our mouth is when we say that we value it.
Right, it's so foundational, and it really is going to take all hands on deck. The business community, as you said, public-private partnerships. There's so many kind of roads in and ways to get involved. So, we appreciate all of your insight and perspectives on this. As we close out, is there a brief nugget of wisdom or closing reflection that you want to share with our community?
Well, I've said it, but I'll say it again. The kind of the closing nugget I want to leave people with. My goal is to empower parents and early educators and people who care about young children. While there's all this systems level work to be done, and there's all these partnerships, and there's all these funding and policy issues that we need to support, the single most important factor in improving children's life outcomes or making sure that all children get the chance to thrive and live up to their potential is a caring, responsive adult in a safe, secure environment where kids can thrive. And so parents, we're all in this pandemic. Those of you with young children, pat yourself on the shoulder, take a deep breath, realize that you need to take care of yourself. And that in so doing, you are going to be able to help your child in ways that you cannot see on worksheets, right? Enjoying the time you spend together, reading books, exploring the world. And if you have the bandwidth, helping make sure that other children have that benefit as well.
Well, thank you so much for being with us. It's always so fun and informative to talk with you.
It's always my pleasure. You as well, Willa. It's great to have the conversation.
Well, thank you. Thank you, Dr. Jana, for joining us today. We encourage you to visit the Starting at Zero website, startingatzerofilm.com, where you can watch the trailer, request to host a screening, and learn about ways to get involved in moving this work forward. Stay safe, be well, and thanks so much for joining us.